myself Sonia Kumari, and today I am going to demonstrate female pelvis. So firstly we'll know that what is pelvis. So pelvis is also known as our hip bone of the body that connects the spine to the legs. Okay, next we will discuss about the types of the pelvis. So pelvis is of four types. First one is gynecoid pelvis, second one is android pelvis, third one is anthropoid pelvis, and fourth one is platyploid pelvis. So gynecoid pelvis is also known as female pelvis because it will facilitate the childbirth, and second one is android pelvis is also known as male pelvis. Okay, now we will discuss about the function of the pelvis. So function of the pelvis is divided as two. First one is general function of the pelvis, and second one is the obstetrical function of the pelvis. So general function of the pelvis is deals with the it supports the upper body weight of the humans, and it helps with the balance and walking. And another general function is to it protect the organs like bladder, reproductive organ, and rectum. The obstetrical function of this female pelvis is to it facilitates the childbirth. Okay, now we will discuss about the bones of the pelvis. So pelvis is made up of four bones: two innominated bone, one sacrum, and one coccyx. So one by one we will discuss. So first innominated bone is ilium. The upper flared part of this bone is known as ilium, and the lower or inferior part of this bone is known as ischium, and the anterior part of this bone is known as pubic bone, and posteriorly it joins with the sacrum and coccyx. Okay, so first innominated bone is ilium. So ilium has also some parts. So upper border of this ilium is known as the iliac crest, and the depressed one part is known as the iliac fossa, and posteriorly this rough part of this ilium bone is known as the iliac tuberosity. Okay, now ischium bone. So this ischium bone is some parts. So this rough part is known as the ischial tuberosity. This prominent part of this ischium bone is known as the ischial spine, which help to assess the station of the fetus. The pubic bone is consists pubic arc and rami. It forms the rami. So it forms inferiorly inferior rami and superiorly superior rami. Okay, now we will discuss that there is some spines or nerves supply from this ilium bone. So anterior superior iliac spine, anterior inferior iliac spine, like that only. Posterior superior iliac spine, and posterior inferior iliac spine. Okay, after that we will discuss about the joints of the pelvis. So here are three joints of the pelvis. First one is the sacroiliac joint. It is the strongest joints of the pelvis. In anteriorly symphysopubic joint, and posteriorly sacrococcygeal joint. So this pubic body will this pubic body and the rami and the ischium bone is formed as structure is known as the turator foramen, and this depressed cup-like structure is known as the acetabolum. From here only the head of the femur bone is connect or okay. Now we will see the there is some notch will present in the pelvis. So this is the greater sciatic notch, and this is known as the lesser sciatic notch. Now we will discuss about the ligaments of the pelvis. So mainly 6 ligaments we will study here, but another 2 ligaments also is present in the pelvis. So first one is the sacroiliac ligament. It is in 2 sacroiliac ligament. Second one is the symphysopubic ligament. Third one is the sacrococcygeal ligament. Fourth one is the bispinous ligament, and fifth one is the bituberous ligament. The another 2 ligaments is sacroiliac ligament and sacrospinous ligament. Okay, so this female pelvis, as we know that it facilitates this childbirth. So this female pelvis is of 2 types. First one is the true pelvis, and second one is known as the false pelvis. So the upper part, which only helps to support the organ, is known as the false pelvis. It will not facilitate the childbirth, and the the part of the pelvis which facilitate or passes through the birth in the childbirth is known as the true pelvis. So it consists three parts: pelvic brim or inlet, and the pelvic cavity, and outer part is known as the pelvic outlet. So after that we will discuss about the diameter of the pelvis. So firstly we will discuss about the diameter of this brim or inlet. It consists of three diameter: anterior posterior diameter, transverse diameter, and oblique diameter. So anterior posterior diameter also consists three conjugate. First one is true conjugate, second one is obstetrical conjugate, and third one is the diagonal conjugate. So true conjugate is measured by the upper part of the symphysis pubis to the midpoint of the sacral promontory, and it is of 11 centimeter. The next one is the obstetrical conjugate, and it is measured by the midpoint of the symphysis pubis to the upper border of the sacral promontory, and it is of 10 centimeter. The last one is the diagonal conjugate, and it is measured by the lower part of the symphysis pubis to the midpoint of the sacral promontory, and it is of 12 centimeter. Then we will see the transverse diameter of this brim. So transverse diameter is measured by the between two iliopectineal line, and it is of 13 centimeter, and it is the largest diameter of the pelvic brim or outlet. The last one is the transverse diameter of this pelvis, and it is measured by the sacroiliac joint to the iliopubic eminence both sides, and it is measured as 12 centimeter. After that we will see the diameter of the cavity. So diameter of the cavity consists to three measures: anterior posterior diameter, transverse diameter, anterior posterior diameter, transverse diameter, and oblique diameter. So anterior posterior diameter is measured as 2/3 part of the sacrum to the lower border of the symphysis pubis, and it is of 12 centimeter. The another transverse and oblique diameter is not possible to measure in the pelvic cavity, because here is the muscles arrangement and nerve supply is there, so we can't measure. So we just considered as 12 centimeter. Okay, now we will see the diameter of the outlet. So diameter of the outlet consists two conjugate: obstetrical conjugate and anatomical conjugate. In the obstetrical conjugate we will see the anterior posterior diameter and transverse diameter and oblique diameter. So oblique diameter is not possible, so here we will see only the anterior posterior diameter and transverse diameter. So the anterior posterior diameter is measured by the tip of the coccyx to the lower border of the symphysis pubis, and it is of 11 centimeter. Okay, next one is the transverse diameter of the outlet, and it is measured between the ischial spine, and it is of 10.5 centimeter. So another one is the anatomical conjugate, or it is also called the true conjugate. It deals with the anatomical anterior posterior diameter and transverse diameter. So anterior posterior diameter is measured as tip of the coccyx to the lower border of the symphysis pubis, and it is of 13 centimeter. The transverse diameter is between the two intertuberous, so it is measured as here only between two intertuberous, and it is of 11 centimeter. The oblique diameter is not possible because of muscles arrangement. So this is about the diameter of the pelvis. So now we will discuss about the landmarks of the pelvis. So landmarks of the pelvis, if we want to sew anteriorly, so we can start from here, and if we want to sew posteriorly, so we can start from this sacral promontory. So the landmarks of the pelvis, so first one is the upper border of the symphysis pubis, pubic crest, pubic tubercle. This line is known as the pectineal line, iliopubic eminence. This second line is known as the iliopectineal line, and this joint is known as the sacroiliac joint, and this flared part is known as the wings of ala or ala of sacrum, and this flat part is known as the sacral promontory.